Okay, well, hello everybody. Welcome to the Healthy Joints Healthy Lifestyle Show. And for those who don't know me, my name is Dr. Arinola Dada. I help people with joint pain become pain-free and people with autoimmune disease get their immune system back on track. So today I have one of my dearest friends and brilliant gastroenterologist, Dr. Vivian Asamoah, who is a certified gastroenterologist with an emphasis on evidence-based integrative functional medicine. So I am going to let Dr. Asamoah introduce herself, and then we are going to get started.
Thank you so much for having me on your show, Dr. Dada. To everyone, I'm Dr. V. I'm an integrative gastroenterologist. My practice is called the Houston Gastro Institute. We are nestled in West Houston, Katy. I have been in practice for over a decade, and my whole focus with patients is really blending the best of both worlds, conventional medicine and a more holistic approach to gastroenterology care. I'm delighted to be on your show today.
Well, thank you so much. We have an exciting show today because we are going to talk about inflammatory bowel disease. We're going to talk about Crohn's, diarrhea, bloody stools, all that stuff, right? And so I'm so grateful that Dr. Asamoah took some time out of a busy weekend to spend some time with us to talk about Crohn's and inflammatory bowel disease. So Dr. Asamoah, let's just jump right into it. So
Okay.
what is Crohn's disease and what kind of symptoms do people experience? Can you tell us?
So when we talk about inflammatory bowel disease, I want to start off just by highlighting that this is very different to irritable bowel syndrome, but they all start with IB. So very often patients get them confused. They are two completely different entities. The key word to remember is inflammatory. It is something that is driven by inflammation. And so there's an inflammatory process happening in the gut. And Dr. Dada will tell us that it even happens beyond the gut. And I think that's what we'll be diving more into. But it usually can happen anywhere from mouth, with people presenting with canker sores in their mouth, all the way down to the esophagus, the small bowel. Most commonly, we see inflammatory bowel disease in the small bowel and the colon. So patients may present with abdominal pain, bloating, diarrhea or constipation, rectal bleeding, and sometimes, guys, it could be as simple as just weight loss, fevers. I just don't feel good, right? We know that there's some inflammatory condition brewing in the system. And under the belt of inflammatory bowel disease, I think the two major headers that I think we should talk about is Crohn's disease, which I think is pretty common, right? We talk a lot about
Yes, it is.
Crohn's disease.
Yeah.
And then another one called ulcerative colitis. They're like brother and sister. They
Yeah.
present a little bit differently, but it all boils down to inflammation.
Yeah.
Yeah.
Yeah, and so in our world, right, so a lot of times when our patients overlap in the GI world, the gastroenterologist world, and the rheumatology world, is usually when there's inflammatory bowel disease and they now have symptoms outside the bowel. Right. So sometimes,
Absolutely.
yeah, patients come in with back pain. We find out that they
Yep.
have inflammation in their spine, and we
Yes.
find out that people with inflammatory bowel disease are also prone to inflammatory arthritis.
Yeah.
So how do symptoms of Crohn's, because I know how arthritis symptoms impact your daily life, it's pretty obvious, but
Yeah.
how does Crohn's disease impact the patient's daily life?
Oh, wow. In so many ways. And this is all dependent on, when we want to make that diagnosis pretty quickly, right, Doc? We want to make that diagnosis. And, a lot of times our patients with Crohn's disease and ulcerative colitis will present with fatigue. So imagine you're tired all the time. You're not sure why. You may be in your 30s and your 20s. You're just exhausted all the time. So fatigue, unexplained fevers, having belly pain after you eat. It seems like eating becomes something you're even scared to do because you're worried about the symptoms you'll have. Diarrhea, just kind of weird bowel movements all over the place. And then when they start seeing blood, it's concerning. So I
Yeah.
think it impacts, from I typically work with adults, so over 18-year-old, but we can see inflammatory bowel disease starting at a very young, tender age. So we see it in kids,
Yeah.
but we see a lot of them present in their teens to 20s. is the peak of presentation, the first peak of presentation. So kids aren't able to go to school. They have to drop out of college, take a year out, having to cut class. And then that seeps into adulthood where you're having to do the same thing at work. So huge impact. So it's really important that you work with a provider like Dr. Dada, who really understands how symptoms can impact you and start getting a diagnosis quickly. And the reason I'm actually saying work with, very important to highlight any gut symptoms to a rheumatologist, doc, is because sometimes those back pain symptoms begin before even the patient has gut symptoms. So sometimes the rheumatologist is the one to send us a patient because I suspect they have Crohn's disease, right?
Yeah. Patients are always intrigued or wondering why I'm asking God questions. They came here for their back pain, and I'm like, let's talk about your poop. Let's talk about the consistency. Is there blood in it? Do you have abdominal pain? And they're looking at me like, how does this affect my back? It does. It's a big picture. It's just one body with a lot of interconnectedness.
Yes.
So, actually talking about impact, I actually had a patient who had Crohn's and arthritis, which is how I know her. Absolutely lovely girl, was away in Europe and said that she had such bad diarrhea. And in Europe, apparently, I found out from her, restrooms are not that easy to access. So I did not know that. We're so spoiled here. She said restrooms were not easy to access. So being on public transportation, she was in a little bit of a bind. So it got her to where she was too scared to leave her apartment.
Oh, that messes up the entire vacation.
It does mess up the entire vacation. Yeah. So she was the one that let me know that restrooms are not that easy to access.
They're not. They have those portable restrooms, and the portables, and very often you have to pay to get in. And if you go into a restaurant trying to use a restroom, they will not let you in if you no. She's so right. No, she's so right.
Yeah. So, and then, going past symptoms is, the treatment options, right, that are available for, inflammatory bowel disease, Crohn's. So what are the current treatments and how do they help manage these symptoms?
Well, there are, I think this is maybe not a wonderful time to have IBD. It's never a wonderful time to have IBD, but I think if there was ever a time to have treatment options available to you, there are treatments coming out of the woodworks for inflammatory bowel disease, because I think what we're doing now is we're really trying to target where the inflammation is happening, like at which cellular level the inflammation is happening. So this has opened the doors for even more conversations between me as a gastroenterologist and the rheumatologist that I work with to kind of figure out what is the best possible treatment, almost a personalized approach, right? To helping our patient who has maybe ankylosing spondylitis as well as and Crohn's disease. So much from anti-TNFs to IL-23s, IL-12. There's a lot. JAK1 inhibitors. There are so many treatments, but I think maybe people on this platform will be very used to hearing terms like Humira and Remicade and Skyrizi and so many Entyvio, so many other treatments available, many biologics that are available.
So question, have we come a long way in Crohn's in the last 20 years and in treating inflammatory bowel disease?
Yeah, I think the answer is yes and no. I think from a pharmacological standpoint, in terms of drug delivery, making medications, creating, the pharmaceuticals are right on it in terms of research. But no, because we also know that the incidence of Crohn's is rising, as well as ulcerative colitis. And with autoimmune condition, Dr. Dada, I don't envy rheumatology because that's all you guys deal with. Focusing on the root cause is the hardest thing. And it's the biggest question a lot of patients have was, why do I have this autoimmune disease? And I always have to tell patients, it's nothing you did. It's not your fault. Some of it is genetics, viral, this, that. But I feel like the real game changer for us as physicians to help our patients would be if we get a little bit closer to the steps to understanding why, by looking at, microbiota and looking at genetics and actually trying to even gauge who's going to get an inflammatory bowel disease before they even get it? And how do we prevent? That, I think, would be the success. That would be the game changer. But
Yeah.
treatments are out there, plenty.
Yeah.
Yeah.
Plenty of treatments. Yeah.
Yes.
Yeah, that is, yeah. And that kind of plays into a lot of the work that you do, right? In the integrative functional medicine space, right?
Yes, absolutely. We really try and look at root cause. There was a time where we were telling our patients with IBD that food did not matter. And we know very well now that it makes a significant difference. Maybe not when the diagnosis is already established, but to reduce the frequency of flares. How often are you going to flare up? So if you look at the Crohn's and Colitis Foundation, which is a fantastic resource for patients with IBD and rheumatological disorders or other extraintestinal manifestations, the focus really now is on nutrition. There's a lot of information about nutrition and how you as a patient can empower yourself. This is, these are your own toolbox to help prevent disease recurrence. So in our integrative practice, we focus a lot on food as medicine.
Yeah,
Yeah,
I totally agree because you're right. I think kind of in training as physicians, we're more focusing on kind of solving the problem after it's occurred, rather than kind of going back to root cause and seeing how can we prevent the problems anyway.
true.
So and actually and whether we're looking at kind of root cause or we're looking at treatment options, or preventing or even monitoring current medications or even adjusting doses, I think there is a role for clinical trials. And I know
Yes.
that you participate in that and you're a strong advocate. Do you think that it's benefited patients specifically? Any thoughts on that?
Absolutely. We are currently running 2 trials for our patients with Crohn's disease and IBD, and we're looking at, how effective these medications are going to be. I think it's absolutely important because we have to start really personalizing the treatment. Who is going to be the best candidate? Who's going to get the best benefit from this particular treatment? Because we're getting to a place, it's not a one size fits all. And so that's the purpose of our clinical trials. We want to make sure we include women, women of childbearing age, maybe women who are postmenopausal. We want to make sure we include all races. We don't want to single out just the Caucasians. I mean, IBD affects all of us. So, having that diverse population, which I think you get it a lot from community-based physicians like us. And I know, Dr. Dada, you have a strong research arm that you're growing too. And I certainly encourage your patients with rheum disorders to join because, there's a big difference between research that's done in a big hospital somewhere far, far away, where maybe those people are pre-selected. They don't look just like you, right? They don't act
Yeah.
like you. They don't have to doing research with your provider, with your physician, your specialist in your community, where your doctor is seeing many patients who are very similar, maybe same ethnic, socioeconomic. You eat at the same HEB and Kroger, you're
Yeah.
exposed to the same things,
Yeah.
and there, I think there's definitely tremendous benefit by I think it's an honor for us as physicians to be involved in clinical research, but we are so grateful to our patients who participate in our clinical research trials because I think overall that patient is helping the next patient and is actually helping the next hundreds of patients and thousands to figure out best treatment. So yes, we do run some trials and have some for IBD right now that are ongoing.
Yeah, I don't think I could say it better. I almost feel like I have nothing to add other than we also are very grateful to patients who are participating because it's not just helping that person, it's helping humanity, right? The results of that can be felt reverberating around the world. If we can target, because we have so many treatments, exactly what you're saying, but who is the best candidate for what? Because right now, if you come in with inflammatory bowel disease related with inflammatory arthritis, I have 7 options.
There you
And
go.
we don't know who would be the best candidate for what. And clinical trials is really going to help us get there. So yeah.
Excellent.
So, and Dr. Asamoah, I already know patients that have seen you, that have had amazing outcomes, but I need you to share a story of a patient who's had a phenomenal outcome after being in your care.
Oh, okay. A phenomenal outcome. So this is going to be an IBD patient, right? We're going to pick.
Okay.
Yeah, so I have a wonderful case for you, Dr. Dada. So this is a
Yes.
case I had never seen, and maybe you will be more familiar with it. This is a patient that came to me at age 21. So he was in college and he was born, he developed a diagnosis of osteonecrosis of the jaw, an
Mm,
inflammatory osteonecrosis of the jaw that I
mm,
had never heard about since he was 7. So this is an
mm,
autoimmune condition where this young boy would have severe pain in the jaw, and he would have to use, his doctor at the time was putting him on a
mm.
lot of NSAIDs,
Yeah.
non-steroidal anti-inflammatories. And he present, so he'd been going through that for many years, and then he presented with a few weeks history of just horrible bloody diarrhea. And I did an colonoscopy, and he was
Mm,
diagnosed with ulcerative colitis. So
mm.
again, a second autoimmune condition, one
Wow.
begetting the second one.
Yes.
And the success story here is that when the diagnosis was established, he told me that, Doc, I am willing to do everything I need to do to get better, but I'm so young that I don't want to be on harsh therapies,
Yeah.
biologics, right? He says,
Yeah.
if we can avoid it. And I said,
Mm,
well, I'm glad that you are willing to change lifestyle and diet and all these
mm.
things, but it may not be enough. And we may
Yes.
need to have you on biologics. So, as I said, I'm integrative. I don't believe in just one way, it's the best
Yeah.
of both worlds.
Best
So,
way.
the best way. And so we started working on his diet, and his diet was not bad, but he was a teenager, he's eat pizza and all these things. And we put him on something called the autoimmune protocol. But I also had to start him on steroids right away because his symptoms were pretty severe. And I transitioned to the next step, which for him was an ASA, right? Which is a sort of a simple oral medication that you can take for ulcerative colitis. And we made sure his vitamin D was on point. We beefed up his nutrients, right? So macronutrients and micronutrient support. We had him on curcumin, which has been shown to be extremely beneficial in combination with 5-ASAs in treating. We have lots of studies now in treating IBD. And we did that combination for about 3 to 6 months. And his
Yeah.
rheumatologist was very concerned that he may need a biologic, right?
Mm.
Because he had the underlying,
Yeah.
and
Yeah.
she was always trying to, and he was so adamant that he
He
really
was
wanted
gonna
to try.
try.
and
Hmm.
and and fast forward, I spoke to him yesterday at a consult. We had a phone consult. He's now about 26, 27. He teaches at he's a math teacher, smart kid. He's
Oh.
a whiz. He teaches math. He's weightlifting and whatnot, and he's not on a biologic. He did extremely well with the current treatment. He stayed on a 5-ASA. He has continued to monitor his diet. He stayed
Yeah.
pretty much autoimmune paleo, so he's gluten-free,
Yeah.
dairy-free, very
Yeah.
little sugar.
Yeah.
And he just told me that he's got a serious girlfriend right now. So for me, that is a success story.
That's a win. That is
It's
a
a
big
big
win.
win,
That's
big
a big
win, big
win.
win. He's
That's
living his
yeah,
life.
that is a big win. But I would say kudos to him for following the instructions. But he had
Yes,
also had a coach, basically. You know,
yes,
he had Dr. Asamoah, and you have an amazing team. You have a nutritionist, you have a
yes,
massive team
yes,
that really helps people to kind of get to that point. I
yes,
think just on your own, I think it's hard to just kind of pick up a diet and say, I'm going to try to follow this because there are too many pitfalls. So I think working with someone like you and your team
yes.
actually makes it more likely that people will be successful. So thank you for that amazing
Thank
story.
you.
And also thank you for kind of also showcasing what your team is capable of achieving for people.
Thank you so much, Dr. Dada.
So question I think everybody wants to know is where they find you, how they work with you, how they get the inflammatory bowel disease under control. I'm going to put your information on the show notes, but can you share, please?
Yes, I would love to work with anybody with inflammatory bowel disease using a more integrative and holistic approach. My practice is located in Texas. We do virtual consults for people within Texas. We may be expanding soon, but I think a good place to start for people to get to know me and know our practice is a private Facebook community we've been developing over the last 3 years called Natural Gut Relief. We have wonderful interviews there with IBDologists, so experts who only do IBD, and how nutrition and holistic methods can help with IBD, but we also talk about everything else related to natural gut relief. So that's on Facebook. It's called Natural Gut Relief. Otherwise, you can find me on Instagram, on regular Facebook, on LinkedIn as Dr. Vivian Asamoah.
Wow, wonderful. Well, thank you so much for coming on the show. Thank you, everybody, for listening. If you are in the greater Seattle area, look us up at overlakearthritis.com. Do share this video with anybody that you think will benefit from this. Like it and subscribe to our channel. See you guys next time. Thank you so much.
Bye-bye.
Bye, Dr. Asamoah.